Hi, I'm Dr. Hans Dio, the founder of CHIP, the Complete Health Improvement Program, and a clinical professor of preventive medicine at Loma Linda University in California. Welcome. Actually, I want to applaud you for your good judgment of joining the CHIP movement, which is offering people everywhere validated hope, improved health, and more options to find the best life possible. CHIP, then, is an exciting educational adventure. You'll be exposed to the very best research available of how to live a fuller life, a longer life. And our goal is helping you to die younger as late as possible. Are you ready for this?
Good afternoon. Welcome from sunny Florida. It's actually not sunny here. It's pouring like crazy, but it's still a beautiful day. So I want to welcome everyone to the second session that we're having today, and we have a lot to talk about. But before I really get into the content for today's program, I just want to pray that everyone is safe and healthy and dealing with the stress of life as effectively as possible, because we're all dealing with so much lately. It really is, it's amazing that we've come this far. Module 1 is entitled The Rise and Rise of Chronic Disease. And when I think of chronic illness, we think of illnesses such as heart disease and diabetes and osteoarthritis, etc. And it was really interesting, and I'll show you this. This is actually an article from today's New York Times. Other causes of death have surged as well. And this is something that we've alluded to recently in relation to the coronavirus pandemic. We forget about the fact that so many other illnesses are still causing death and disability on a daily basis. And when we spoke at the last session, we talked about the fact that most physicians and most healthcare providers have been dealing with multiple pandemics simultaneously, and this is really just a testament to that. Unfortunately, we can see that on this page here that heart disease and diabetes have increased 15% in the last several months, and probably a lot of that has to do with coronavirus. So really what I've seen lately is that stress in and of itself has almost become a chronic illness. And this is really so important in this time. We're dealing with the coronavirus since January, but now we've been inundated over the last several days with another national disaster, and the civil unrest that's occurred has really resulted in a lot of fear and panic and anxiety, and in and of itself is becoming a chronic illness. Chronic illnesses, as we know, leads to a lot of physical problems, a lot of mental complications. And when we look at it from that perspective, how do we deal with that in and of itself? And how does this really relate to the CHIP program and what we will talk about today? And again, the reasons for today's visit. As we all know, chronic illness has at its core chronic systemic inflammation. And when we think about chronic systemic inflammation, we know that this is the cause and the root cause for many illnesses that we deal with. When we look at heart disease, when we look at osteoarthritis, even when we look at obesity and diabetes, we know that systemic inflammation is at least part of the reason. But for many of those illnesses, it's actually the root cause of the disease. So taking this a step further, when we talk about the standard American diet and the standard American lifestyle, both of those situations are really examples of systemic inflammation. We know that basically meat and animal protein and dairy and the American lifestyle, which is basically a sedentary lifestyle filled with lots of stress and other health complications, we know that all of that rolls into systemic inflammation, and the complications just go on and on. The typical standard American diet, when we look at animal protein and dairy, is filled with omega-6 fatty acids. And we know that omega-6 fatty acids are really inflammatory, and that's really, the root of the problem. So when we look at all of the things that I've just mentioned, how do we help patients to deal with the stress in life so that they can decrease the systemic inflammation that I just talked about, and decrease the risk of all of these chronic illnesses that we will discuss today. So the CHIP Module 1, I'll run down a list of the topics that are discussed in Module 1. The history of medicine and healthcare, the fact that lifestyle is the best medicine, the optimal lifestyle, and we'll talk about that more today. You'll hear more about eat more, weigh less, fiber is your best friend, getting to the heart of the matter, disarming diabetes, cancer prevention, nutrition myths, move more, active living, getting to success. One topic that I really like to talk about myself is that DNA is not your destiny, and I've given multiple presentations on epigenetics and why DNA is not your destiny, and we can talk about that more today. And then re-engineering your environment. Last night, while I was reviewing the Module 1, I was really impressed by some of the statistics, and Dr. Deal does a great job of mentioning this and highlighting this. Since World War II, the incidence of diabetes has increased 900%. 900%, think about that. And the incidence of diabetes has doubled every 20 years since that time. So I'll take a moment so that we could just put up on the screen a little video that talks about that a little bit more, and then I'll come back on the screen.
Here you see how the colors are changing every 5 years, signaling a 5% increase in obesity with every new color. Starting with less than 10% of the adult population being obese in 1985, the charts end with close to 35% now being obese today. And you may ask the question, well, what about diabetes? And here again, you see a dramatic increase, a 900% increase in some age categories in diabetes since World War II. We're swept up by a tsunami of diabetes. All the advances in medication and implants have not changed the trend in diabetes with all of its circulation-related complications. As a matter of fact, many public policy administrators rank diabetes today as the mother of all chronic diseases. Here you see diabetes has been inexorably advancing, doubling every 20 years. And the chance of becoming a diabetic in America for a newborn baby in a lifetime is now 1 out of 3. And the National Institutes of Health says we have no medical cure.
Well, that's interesting, isn't it? I mean, the statistics are staggering, but I think we really need to focus on, do we actually have a cure, a medical cure? And we know that lifestyle is medicine, and we know that food is medicine. So in reality, we do have a medical cure. The important point, though, is that we always have to get back to the root cause of an illness. The video clip talked about disarming diabetes. Diabetes is absolutely another pandemic. So many people in this country and in developed countries are suffering from the complications of diabetes. Most people with diabetes actually die from cardiovascular disease. They don't die from high blood sugars or low blood sugars. They die because they develop systemic inflammation, blocked arteries. They have more incidence of strokes, more incidence of heart disease, and that's typically what they pass away from. So we'll take in another minute, we'll look at another video. Dr. Deal does a great job of talking about the poisoned well, and the story of the poisoned well is really interesting. So let's go to that video, and then I'll come back on the screen.
The village well was poisoned, and the doctors and nurses and people all ran about buying new beds, giving them medicines, and providing lifelong care for those crippled and diseased. They became very adept in treating the ill. They refined the medicines. They discovered new and stronger antidotes. They trained people to care for the sick, and they built beautiful temples to accommodate the chronically ill. Better treatment procedures were invented. Emergency services were developed. There never had been better medical care anywhere. But the patients kept coming and coming and coming. And the statistics kept rising and rising and rising. Why? Because no one treated the source of the problem, the poisoned well. And Dr. Robert Allen makes a very interesting comment about this little story. He says, quote, "Our culture today is a poisoned well. Our culture does not encourage people to be healthy. Even our medical system mainly focuses on illness after the damage has been done. It has become a salvage operation that largely specializes in the management of victims. Our efforts," he said, "and our money go to treat the results of our illness culture." He said, "We buy crutches for the crippled. We give tranquilizers to the stressed. We treat tumor-filled lungs of smokers on their way to death. We spend billions on coronary care units for the heart attack victims whose bad eating or smoking habits brought them to the crisis. We provide artificial hearts. We provide artificial hips and kidneys for those whose bodies have broken down. We have looked at disease so long that we have forgotten about health."
We have looked at disease for so long that we have forgotten about health. Think about that statement. It's really so impactful. And again, when we spoke about this previously, when we look at our healthcare system, we really don't have a healthcare system. We have a sick care system. And as really mentioned in that little video clip, we have a system that basically waits for people to get sick, and then we try to cure them. And that oftentimes is not very helpful. We know that significantly, individuals that have bypass surgery, that have coronary artery bypass surgery, oftentimes end up back in the operating room 5 years later because they haven't done something that's so vital to their treatment and their cure. They haven't changed their lifestyle. And it's really unfortunate. I hear this from many patients that they have the impression that if they've had a stent or if they've had a bypass, that their heart disease is essentially cured. It was really interesting. I had a patient not too long ago that when we were going through the past medical history, I asked specifically, do you have any history of heart problems? No. Do you have any history of this? No. But then when we got to the surgical history, I said, did you have any surgeries? Oh yeah, I had a bypass. So I said, well, wait a second. I mean, that you just told me that you don't have any heart disease, but you had a bypass. Oh yeah, the bypass cured my problem. That's really interesting that a patient would come away with believing that their heart disease is cured because 1 or 2 or maybe 3 of their blockages were bypassed. What about the thousands of other arteries that you have in your heart? And what about the thousands of other arteries you have in the rest of your body? All of those arteries are also clogged. So we really have to look at what's the root cause of the disease and what can we actually do about it to make things better. Why lifestyle is the best medicine. There have been so many research articles and published reports that show that lifestyle in and of itself, with nutrition and physical activity as the foundation, are just as effective and in many cases more effective than the medicines, the procedures, and the surgeries that so many people in America are really used to as the go-to therapy, if you will. So I think that we have to prioritize our daily routine and figure out what is the optimal way of living so that on each day I could be as healthy as possible and I can decrease my risk factors for all of these chronic illnesses. I could decrease the incidence of all of these complications. And even more importantly, and this question has come up so many times in the last few months with coronavirus, how do I strengthen my system? How do I strengthen my immune system so that I could be prepared, be more physically and physiologically prepared for the next pandemic that comes? Because, you know, sooner or later that's going to happen. I love this section of Module 1 where we talk about eat more and weigh less. And statistically, we know that people that are eating more plant-based foods weigh less. They eat more food because the food is actually more voluminous, more bulky. So they get that satiety feeling much greater than when you're eating the standard American foods. Eating more food and weighing less is important to longevity. The research actually shows that people that weigh less have less toxins in their system. They actually live longer. So there's a tremendous benefit to eating the plant-based foods that we talk about over and over again in the CHIP program. Fiber is your best friend. That's a great thing to talk about, because many people don't get the typical 40 grams of fiber that they should be eating on a daily basis. But when you start eating more plant-based foods, you add lots of vegetables in your diet, you add some whole fruits in your diet, now you're getting the fiber that you need for your GI system to stay healthy, to feed your microbiome, which we'll talk about a lot during these sessions, and to keep your body healthy as you possibly can. Looking specifically about cancer prevention, which is part of this module. Cancer prevention and decreasing the recurrence of cancer is really important from a nutritional perspective. And again, I'm really disheartened so often when my patients will talk to me about their cancer and their treatment and the things that they're doing to try and hopefully decrease the incidence of recurrence. But so often they're not hearing from their oncologist that nutrition really matters. And we really have to emphasize that. If you have a risk for cancer, if God forbid you've had a cancer and now you're trying to decrease the recurrence of that cancer, you have to be on, I say this over and over again, you really need to be on a plant-based diet. That is the one nutrition program that really has such a tremendous impact on decreasing the risk, decreasing the incidence, and decreasing the recurrence. And for the people that are on the call today, if you have not read the China study by Dr. T. Colin Campbell, I implore you to do that as soon as you can, because it really gives you a foundation of knowledge that you can use with your clients and with your patients to really make them understand how important it is to be on a plant-based diet, to live a very healthy lifestyle if you're going to decrease the incidence and improve your chances of not getting cancer again. Nutrition myths, I think when we look at people that are talking about keto diets and different types of diets, and I use that word in comparison to a nutrition program, there are so many myths out there in relation to what keto diets do, what dairy does to your body, and we can dispel all of those myths. And research really has shown that the standard American diet creates more chronic illnesses and decreases not only the quality of life, but your longevity. Milk does the body good. I mean, that's another crazy thing that we have to talk about. And the myth really of dairy and osteoporosis. We know that the data clearly shows that people that eat more dairy and drink more milk have more problems with osteoporosis. And, you know, the module will get into that more. Making sure that you're living an active life, making sure that you're set up for this success. And this is where the CHIP facilitators, I think, do a phenomenal job at really helping people create a lifestyle that leads to more health and more vitality and more wellness. And the last two things before we close, we have a few more minutes and maybe we'll get a few more questions in the chat box. Your DNA is not your destiny. If you don't know about the science of epigenetics, it's a great field of science that actually shows that you can turn on healthy genes and you can turn off unhealthy genes by what you do with your lifestyle, and specifically, again, in relation to nutrition and physical activity. Dr. Dean Ornish has done a phenomenal job over the years, over the last 40 years, really proving that diseases such as prostate cancer and breast cancer, which pathophysiologically are very related, decrease dramatically when you change to a healthy lifestyle, when you're eating more plant-based foods, when you're getting good physical activity, lowering your stress and improving your sleep. So there is tremendous hope even for the individuals that have supposedly inherited a bad lifestyle, bad genes, if you will. But in reality, what we see is that what people actually inherit is a bad lifestyle, not necessarily bad genes. And even when they do inherit bad genes, we know that, again, from what I just mentioned, you can turn those genes off, the bad genes, and you can turn healthier genes on to improve your health by your lifestyle. And then lastly, in the last few minutes, re-engineering your environment. When you create a lifestyle and an environment that is the default, a healthy lifestyle and a healthy environment that becomes the default, the easy button, if you will, you create an environment that surrounds you with all of the tools that are necessary to stay healthy. And this is why, again, in closing, I can talk about the fact that the knowledge that you gain from learning about healthy living and plant-based eating is only as useful as the tools that you have in your toolbox. And I really look at CHIP, the CHIP program, as the toolbox that allows you to take that knowledge and put it into action in your daily life, whether you're at home, at work, in the restaurants, wherever. So don't forget to take your toolbox with you. Again, I'm going to ask, and I'll take a peek. I'm sorry, I'll just take a peek at my phone just to see if we have any particular questions. If you want to put a question into the chat box, please do so. Actually, we do have a question in there now. Is there a simple blood test to diagnose adrenal fatigue? There is a blood test. I wouldn't necessarily say that it's simple. There are ways to test the adrenal function. Sometimes you could do that with a quick routine blood test, but oftentimes you have to do more 24-hour monitoring to get a better assessment of the adrenal function. But adrenal function relates dramatically to stress. In a stressful environment, whether it's a physical stress or a mental stress, the adrenal glands are constantly pumping out cortisol. And after a while, the adrenal glands become insufficient. They don't function the way they're supposed to. And if that stress continues for a chronically long period of time, the adrenal glands actually start to fail. That's when individuals start to complain that they're always tired, despite the fact that they're sleeping well, and they really just can't understand their symptoms. And again, it always relates to what's happening in your life, in your lifestyle that's affecting the function of your body, and then what can you do about that will really make a significant difference. And so much of what we talk about really gets back to the foundations of healthy living. Are you eating healthy? Do you know what eating healthy really even means? And we talk about that over and over again. And this is where obviously the CHIP facilitators and the people that have been through the CHIP program really understand what a lot of people think is healthy living and healthy eating is not necessarily so. And when you go through the CHIP program and all of the modules and the 19 sessions, then you really understand what healthy eating and healthy living is all about. So healthy eating, regular physical activity, decreasing the stress in your life as much as you possibly can, making sure that you're getting enough sleep, quality sleep, 7 to 8 hours per night, and then having a reason to get out of bed in the morning. There's nothing greater than having a passion in your life that gets you jumping out of bed in the morning so that you can start your day and really be productive and, you know, again, leave a legacy that really makes a difference. And I will talk about that at the end. Where can I find a physician that will understand and use lifestyle medicine with me? That's a great question. I love that question when it comes up. We have a phenomenal community now that I think is really geared and moving towards lifestyle as the foundation for what we should be doing on a daily basis. Plant-based docs, there are a number of sites, and I'll make sure that I have a number of sites available that we can distribute at the next session that talk specifically about this. But where we have a number of physicians in this town, obviously I'm trained in lifestyle medicine through the American College of Lifestyle Medicine. We have about 15 or even 20 now physicians and other healthcare providers such as advanced nurse practitioners that are also board certified in lifestyle medicine. And I'll be sure to distribute some information about that. And for the caller that sent in that question, You can call me directly. I'd be glad to help you with that. Call me, text me, email me, so we could get more information about that. We do have another question. Do we know how much physical damage and mental or emotional stress has on the human body? Well, I think what we're really learning with the coronavirus and all of this unrest that's happening in the nation right now, I don't know that we can specifically quantify, if you will, but we're definitely seeing more chronic anxiety now, more chronic depression, more problems with sleep and insomnia. And when we follow that line of thinking, what do we actually do about that? One of the things that I really would like you as the facilitators of the CHIP program to impress upon the people that are members and participants is the fact that we don't want to look for medicines as the treatment or the cure for that problem. Looking at the root cause of the problem and trying to find more natural ways of dealing with chronic anxiety, chronic depression, chronic insomnia is really the healthier way to do that. And we can talk more and more about that. But undoubtedly, the chronic stress on the human body, physically and mentally, has long-term consequences that we really need to deal with. We have a few minutes left. One more question. Whole soy is often malaligned. It seems only that we're talking about challenges, best stats, and sources. Well, just briefly, I'll talk about soy products. Dr. Michael Greger, a number of years back, did a meta-analysis, looked at all of the studies, or as many studies as he could find, and he does a great job with the science of nutrition, looking at soy products. And this is certainly another health myth, another nutrition myth, if you will. Soy products actually lower the risk of cancer, not increase the risk of cancer. And just quickly, if you look at the incidence of breast and prostate cancer in Asian countries where they start eating soy early on in life, the incidence is much lower for breast and prostate cancer as opposed to in America. So more to come on that. Let me just close by recommending a few things. I'm hoping that you learned something from all of these Ask Dr. Sal sessions, and certainly from the volumes of information that's available through CHIP and from your CHIP facilitators. One of the suggestions would be, when we're able to get back to normal life again, have a dinner party. Have everybody do a potluck dinner party. Bring some plant-based foods to someone's house, but do it in a way that it could be educational, where you can actually have a good roundtable discussion, but maybe also look at the videos that are out there. And I'll give you a list at the next session on more videos that you can look at. But Code Blue is a phenomenal video that if you haven't seen, you definitely want to see that and show it to your CHIP members. Game Changers, obviously another phenomenal video that everybody should be showing over and over again. But lastly, before we close the session, I want to remind everyone that we as healthcare workers, we're here to help. We're all helpers. We are all people that went into this profession for the reason of helping other individuals. And what I'd really like to implore upon everyone that's listening is to keep your eyes and your ears open as much as you can, especially with everything that's going on in the world right now. Keep your eyes and your ears open for those that are in need. And even before someone asks for help, lend a helping hand. You can see that people need help, lend a helping hand, because that's what we really are all about. And if we're really going to leave a legacy, we have to realize that we need to maintain a servant lifestyle. We're here to serve other people, and we really should be doing our best to help as many people as possible. And I think if you can do that, you leave a phenomenal legacy for yourself. So I'll leave you with one last question to think about. What do you want people to say about you when you're gone? If you've lived a servant lifestyle, I think we know the answer. So I want to thank everyone for participating in today's session. I want to say God bless to everyone and hope that the nation gets back to a normal way of life as quickly as we can. And I want to thank you all for participating, and I'll see you next Wednesday.